Hyperhidrosis is what is commonly referred to as the abnormal increase in perspiration or sweating. Although it's important for us to sweat to regulate our body's temperature, some people's systems perspire more than what is needed to maintain the body's temperature, or even in the absence of any obvious triggers to sweating. When it comes to hyperhidrosis, it can be classified into two types: primary hyperhidrosis and secondary hyperhidrosis. Primary hyperhidrosis is also known as congenital or essential. It is the more frequent type of hyperhidrosis. It usually starts to show during childhood or adolescence and goes on for life. It's often localized in one area or in multiple locations or a combination of locations. Anxiety, tension, stress and nervousness, and even anger and fear can intensify sweating, but these psychological stresses are seldom the cause of excessive sweating. Primary hyperhidrosis manifests itself in different ways, depending on its location, and have different effects on the person suffering from the disorder. Facial hyperhidrosis makes you look like an edgy, tense, and nervous person, even if you're not even feeling anxious, because the sweat comes pouring from the forehead and you have to wipe it off often. Especially if you're a woman, wiping up the sweat from your forehead and face often will erase your makeup and make you look bedraggled and disheveled. Palmar hyperhidrosis, or sweaty palms, are the excessive sweating of the palms of your hands. The sweating may vary from a little moisture to an uncontrollable trickle. We perform a lot of functions with our hands, both socially and professionally, and it is very distressing to have sweaty palms while shaking hands or while holding on to a business document. Palmar hyperhidrosis also limits your choice of employment because you will not be able to handle moisture-sensitive materials such as circuit boards or medicines. Axillary hyperhidrosis, or underarm sweating, is the excessive sweating of the armpits, which is usually resistant to any kind of antiperspirants or sweat-controlling medications. This causes embarrassment on the person with this disorder because it usually leaves large wet stains or white marks like salt stains depending on the color of the clothes. There are some instances when this condition becomes evident in men during pre-teens rather than the usual adolescent stage, while for women, it usually starts after puberty. Axillary hyperhidrosis tends to aggravate during times of mental stress, anxiety, or emotional tension. Plantar hyperhidrosis, or the excessive sweating of the soles of the feet, usually occurs concurrently with palmar hyperhidrosis. The most common effects of plantar hyperhidrosis are foot odor, blisters, foot infections, athlete's foot, and moldy or rotting socks. A person with this disorder cannot take on jobs like dancing, martial arts, or aerobics, and any other job that requires working with bare feet. Not only would it be embarrassing, but it can also be dangerous to all, because aside from leaving wet marks around the place, other people might slip and fall due to these wet marks. It's also frustrating and annoying to have to replace shoes often because the moisture damages them easily. Another scenario is not being able to wear sandals because they usually slip off your feet due to the profuse sweat. Secondary hyperhidrosis is the type of hyperhidrosis where excessive sweating is caused by another medical condition that either initiates or intensifies this condition. Some conditions which may promote excessive sweating are hyperthyroidism is a condition that is the result of overproduction of thyroid hormones, resulting in increased metabolism and excessive sweating. Endocrine diseases, such as those that affect the adrenal glands of the kidneys, the neuroendocrine glands of the pancreas, or the pituitary glands, may cause excessive sweating, either localized or generalized. Endocrine treatments for prostate cancer and other malignant cancers or tumors may also aggravate sweating. Acute psychiatric disorders are rarely a cause for primary hyperhidrosis, but excessive sweating may appear when the person is psychologically overstressed, anxious, fearful, troubled, or concerned. Obesity may cause excessive sweating due to the large fat deposits inside the body. Menopause causes excessive sweating due to the decrease in estrogen secreted by the ovaries, resulting in a hormonal imbalance. Night sweats and hot flashes are only some of the indicators of the onset of menopause in women. If you suspect that your excessive sweating is secondary to an underlying medical condition, it is imperative that you have it diagnosed properly. Usually, treating the underlying condition will also relieve you of sweating. Seeing a doctor will help you find ways to cope with excessive sweating. Access to other resources on hyperhidrosis can also help you to further understand this medical condition and learn more about your treatments. You can download a free report at stopsweatingmagic.com/free-report.html. Learn if excessive sweating points to an underlying medical condition. Learn what you should do and what treatments are available. Download your free report and magically stop excessive sweating today.